Welcome to Conversations About Care with Texas Oncology, a video series highlighting prominent topics on cancer care right here in the Central Texas community. In this episode, we'll be talking about the role of emotional and mental health support when it comes to cancer treatment. I'm pleased to be joined today by some of Texas Oncology's Austin-based professionals.
I'm Emily Piercy, and I am the Manager of Clinical Social Work.
I'm Dr. Lynn Knowles. I'm one of the gynecologic oncologists.
I'm Dr. Sean McKenzie, one of the surgical oncologists.
All right, well, welcome, and thank you all for being here to engage with us in this important discussion. Why don't we jump right in? Let's talk about the resources and support systems that Texas Oncology has in place to help patients as they navigate this journey.
Sure. So Texas Oncology provides access to professional social workers that specialize in oncology care. And through that support, we are able to guide patients and family members on the emotional and practical aspects of the disease that also accompany the cancer.
One of the resources we're really blessed with is actually our patients. And we have a lot of patients that offer to be a resource to other patients who have the same cancer or in a similar situation. And that's an incredible resource. And we try very hard to put our patients in contact with each other so they can support each other through the process.
What about support groups? Do you recommend your patients get involved? Talk about why those are so critical.
So the support groups provide this mutual connection that is unique and very, very critical to the patient's time in treatment and beyond.
I think that when you get this diagnosis, everything goes through your head. I worked hard and I retired and my plan was to do this, and now I'm not going to get to do this. But if we live in the moment and enjoy every day and every moment with our family and our support, create a good new normal and do a lot of the normal things that you wanted to do and hope for the future and plan and make plans and go on vacations and have time with your family and not just put that on hold for cancer treatment.
We've all had a friend or a loved one with cancer, and you always ask yourself, what can I do? What can I say? How can I support this? What's the best way to support someone when they're going through cancer?
You want to say the right things. You want to encourage the patient. You want to be there for them. But a lot of times you just need to be quiet and let them talk. And obviously you can encourage them to speak, but a lot of times just that listening is really what they need, not the encouragement, the advice. Those things are great, but when they're struggling like this, sometimes they just need to be heard.
People are always saying, you're going to get through this, you're going to make it. Some patients have a terminal illness, and that feels like they're defeated if they don't win this. So it's having honest conversations like, I'm scared, I'm going to miss you. I think it really letting that patient who's been diagnosed with cancer also it lets them open up and be honest and helps them get through the emotional worry and stages.
And why is it so important for these patients to be properly supported?
Cancer doesn't discriminate. It doesn't go out and seek people who don't have any problems or other things going on in their lives. So we know this, and we know that it complicates things when there's already existing barriers or struggles within a family system. I really work with patients to try to empower them. I like to say, you're the captain of the ship. You work with your doctor and the entire team to make sure that your goals and your values are heard and that we're addressing them along the way, and to find even one small place where you can regain a sense of control.
And we weren't good at that for a while. I mean, especially as physicians, we've sort of were taught we were the captain of the ship, right? And I think over time, there's an appropriate focus that the patient should direct the care plan as much as they can. We have to inform them.
And what about when a patient does hit that emotional low? How do you help them out of that?
I think the first thing, at least that I try to do, is tell them that it's normal. I think, again, we've gotten a lot better at understanding that mental health is a disease that, doesn't owe anyone any apologies, but patients still sometimes feel very guilty about the fact that they feel depressed. I sort of take them through that, you've essentially been through a trauma, and many people will suffer for a period after a trauma, and you cannot feel guilty about it.
Is there anything else about emotional health, mental health about cancer patients that anyone watching this today needs to know? Did we miss anything?
I think knowing recognizing that there's a problem. If you don't feel you can handle it, whether you're the person going through cancer or the caregiver, is to reach out and ask for help. You know, at Texas Oncology, there's plenty of help around the community, but not just suffering in silence.
Yeah, and the help is there. The help is there not only for the patient, but also for the caregivers, as we've discussed, because both of those roles are critically important. And even the caregivers need to ask for help at times because of the caregiver burden. So that's why we have all of these resources available, both within our community, but also within Texas Oncology, to be able to connect them with and help lessen some of that burden.
Well, thank you all for joining us for this very important discussion and for sharing your insights and perspectives on the importance of emotional and mental health. To learn more about the emotional and mental health support services available to patients and their loved ones, visit us online at texasoncology.com.